My name is Dr. Megan Ealy. I teach genetics and developmental biology here at Drury University. The risk of contracting COVID-19 from just passing by someone who may be infected is extremely low, especially if that person is masked and if you're masked as well. So keeping that distance, that 6 feet that everyone's talking about, and making sure you're masked, your risk of contracting the virus is low. So surfaces, as far as we know, it's a lower risk of being able to contract the virus. The best way to make sure that you're not going to be able to do that is to make sure those surfaces are disinfected using that bleach solution that's provided to us by Drury every time you come into the classroom and when you leave the classroom, so you leave it clean for others. And then making sure you're washing those hands as often as possible. So with that bleach solution, that degrades over time, so you want to make sure that that's fresh every time you come to class every day. So we make sure that our surfaces are as clean as possible. As far as we know, COVID-19 is not a waterborne virus, especially if the places in water such as pools or fountains, if those are chemically treated as they should be, those should kill any bacteria and viruses that are in there, so your risk is extremely low. So the throat swabs that we're doing to collect samples for testing at Drury use the same gold standard PCR-based tests as the nasal swab that you may have heard of. These are very accurate tests. They are the gold standard. They're going to tell you whether or not the sample that was collected actually has the virus in it, meaning you're currently infected with the virus. So that's the best way of looking for the virus right now. The antibody tests are not as accurate as these PCR tests, but as we learn more and more tests are coming online that are very accurate and even less invasive, so we may see that we switch to some of these tests in the future. So the surveillance testing or community testing that we're doing at Drury is just to see overall, are we missing any of those asymptomatic cases that may be around? So we're not doing these tests assuming that you are infected. So there's no reason to quarantine if you don't also have symptoms. So of course, if you do start experiencing symptoms and you've been tested previously, it's always good to ask for a second test by either contacting the Panther Clinic or doing the virtual visits through Cox. So if you're contacted by a contact tracer and they're letting you know that you've been in contact with someone they know has contracted coronavirus, you need to do your best to follow the guidelines that they give you. Especially for our college-age students, more of those aged individuals tend to be asymptomatic when they have the virus, meaning you've contracted the virus, you don't show any symptoms, but you can still spread it to others. So if you can quarantine and make sure when you're quarantining, you're staying in the places where you've been asked to stay. And if you need anything, Drury's doing a really good job at making sure we're providing everything you need if you are in quarantine or isolated, but reach out to those contacts and we can help you with that. Even if you follow all of the guidelines that have been given to us by the CDC, our local health authorities, and Drury, you still may end up contracting the virus. And there's no shame in that. We don't know all the ways that we can contract this virus. We just know the major ways we can contract this virus. So we can't blame any individuals for contracting it. We can't feel guilty about contracting it. We're living in a pandemic. There are going to be people who get infected. But if we can, show our humanity through this process, as Drury always does, I think we are going to be really well off, and we will continue to be well off. Eventually, all of this will be over, and we will move on and get back to a more normal state. But the more we can follow all these guidelines and practice good hygiene and be considerate of each other, the better off we're going to be, and the sooner we're going to be able to get back to normal.